All right, let's dive into something, well, something you've probably never heard of before. We're going to talk about a medical sign with a seriously unforgettable name, the sausage digit. Yep, you heard that right. Let's get into its story. So, have you ever heard of a sausage digit? I know, it sounds a little weird, maybe even kind of funny, but trust me, this visual clue is no joke. It's actually a super important signal from our bodies that something much deeper is going on. So, what in the world is it? Okay, so the official medical term is dactylitis, and what it means is a severe, and this part's important, uniform swelling of an entire finger or toe. See, it's not just one knuckle swelling up. The whole thing puffs up evenly, and that's exactly what gives it that, you guessed it, distinctive sausage-like look. So what's actually happening under the skin to cause this? Well, it's not just one single angry joint. Dactylitis is when there's widespread inflammation. We're talking the joints, the tendons, and the ligaments all at once. The entire structure of your finger or toe basically gets inflamed at the same time, and boom, that's what causes that really dramatic swelling. Section 2, the telltale signs. So now that we know what it is, let's talk about how to recognize it. What are the dead giveaways? And here's the thing, it's not just about how it looks. The affected finger or toe is usually super tender and painful to the touch. It can also feel warm and look pretty red because of all that inflammation going on inside. So you take that sausage shape, add in the pain, the heat, and the fact that it's suddenly really hard to bend or move, and that's the classic picture of dactylitis right there. Okay, moving on to section 3, a clue to a deeper cause. So we know what it is, we know what it looks like, but this is where the story gets really fascinating, because dactylitis isn't just a problem with your finger or toe. Nope, it's a huge clue pointing to something much, much bigger going on in your body. This is probably the most important takeaway of this whole thing. Dactylitis is not the disease. It's a signal. Think of it like a flare being shot up from your body, trying to tell you that some other underlying condition needs serious attention. And that's where the real detective work for doctors begins. When they see dactylitis, their brain might immediately think of things like psoriatic arthritis, or maybe other related conditions like reactive arthritis. But it could also be signaling something totally different. We're talking infections like TB or syphilis, and really critically, it can be a sign of sickle cell disease. And that last one is a huge deal. This quote really drives it home. In kids, dactylitis, which they often call hand-foot syndrome, can be the very first symptom of sickle cell disease. Finding that out early is absolutely critical for managing it. So, a simple swollen finger or toe, it could literally be a lifesaver. So, section 4, pathways to treatment. When a doctor sees this, what happens next? What's the game plan? Let's look at how it's managed, because it's all about tackling both the symptom and what's causing it. Okay, so the main goal of treatment is to get that inflammation under control. The first line of defense is usually something like NSAIDs, non-steroidal anti-inflammatory drugs, to help with the pain and swelling. But if it's being caused by a bigger autoimmune issue, they might need to bring in the heavy hitters, like DMARDs or biologicals, which go after the root cause. And for some immediate relief and support, sometimes just splinting the finger or toe can really help out. So, when you boil it all down, what's the big takeaway here? It's that the story of the sausage digit is a perfect example of how a simple, visible sign on the outside can be an incredibly important window into our overall health. It's a powerful reminder that our bodies are always communicating, and we really need to pay attention to the details. And that really just leaves us with one final thought, right? Dactylitis is a pretty loud and obvious signal, but our bodies, they send us signals every single day, and a lot of them are much quieter. So the real question is, are we listening?